I would like to welcome you to my channel, That Middle-Aged Lady. In today's video, I wanted to share my experience after having a nuclear kidney scan done with vascular flow and Lasix due to my urologist finding some swelling in my right kidney near the renal pelvis. But before I get started, I first wanted to share exactly what a nuclear kidney scan with vascular flow and Lasix even is, and why your doctor might order it. What is a nuclear kidney scan with vascular flow and Lasix? A kidney scan, also referred to as a renal scan or a renal scintigraphy, is a diagnostic imaging test that shows the size, shape, and function of the kidneys. It also helps to evaluate how efficiently the kidneys are filtering waste products from the blood and producing urine, while also helping to identify any blockages or abnormalities within the urinary tract. Vascular flow is looking at how well the blood is flowing into and out of the kidneys in order to make sure that everything is working and flowing properly. While Lasix, also referred to as a diuretic, is used to increase the flow of urine in order to differentiate between normal kidney drainage and any type of obstruction or abnormality that may be impeding urine flow. Why might your doctor order a nuclear kidney scan? It could be ordered for any of the following reasons: high blood pressure in renal arteries, referred to as renal hypertension; swollen kidney due to blockage from possible kidney stone, tumor, or cyst, referred to as hydronephrosis; narrowed or blocked renal arteries, referred to as renal artery stenosis; poor kidney function after surgery or kidney transplant. What to expect once you arrive for your appointment. The following account and photos are from my actual scan. However, your experience may vary depending on your doctor, where your scan is done, and why your scan was ordered. My scan was performed at a medical center that was located across the street from the hospital. Once I arrived and was directed to the correct area, I checked in and was told to take a seat and that someone would be with me shortly. The tech then asked for me to follow her into a small room where she proceeded to insert a butterfly needle, also referred to as a butterfly IV or butterfly port, into my arm. The needle is placed directly in a vein, just like with an IV, where it is then taped to prevent it from moving. I can tell you that the needle is relatively small and does not hurt much, if at all, so there is nothing for you to be concerned about. The port is where any medication is then administered that you will need for your scan. I was not aware nor told prior to my scan that I was supposed to drink 16 to 32 ounces of water 1 to 2 hours before it. This is so that both you and your kidneys will be hydrated. The tech then brought me 2 glasses of water and said to take my time drinking them and that she would be back to get me in about 15 to 20 minutes. If you are unsure if you are to drink water prior to your scan as well, this is something that you'll definitely want to check with your doctor. The tech then came back about 15 minutes later and said that it was now time for me to use the restroom to now empty my bladder. From there, I followed her into the room where the scan was to be performed and was surprised to see a chair there rather than a table, as I assumed that I would be lying down, just like when having a CT scan or an MRI. She explained that they do have a machine where you can lay down as well, but it just depends on your doctor's orders, where the scan is being done, and the person's circumstances, since some people might not be able to sit for long periods of time, while others might not be able to lay flat on a table for a long period of time. So this might be a good question for you to ask your doctor before your scan. I then took a seat where she proceeded to introduce the radioactive tracer into the butterfly port. She explained that I might get a metallic taste in my mouth once she inserted it, which I did. However, it wasn't bad and only lasted for a couple of seconds. She further explained that the amount of radioactive material is so low that it does not cause any harm to the body, and that you will be asked to drink a lot of water afterward in order to help pee the rest of it out. I was then asked to sit up straight in the chair with my back right up against the board. The pillow is not only there for comfort, but it also lifts you up in order for your kidneys to fully be seen. I was told to keep my arms down to my side, as any movement can hinder the scan and get in its way. The back part of the machine is the gamma camera, which is an imaging device that is used in nuclear medicine to detect gamma radiation and create images of organs and tissue. It is very helpful for not only showing the organs in detail, but showing how they work in real time. I was then told that this part of the scan lasts 30 minutes. I'm not going to lie, it was definitely difficult to sit there for 30 minutes without being able to move, having no TV to watch or anything to listen to. So unfortunately, you're just going to have to do your best to occupy the time. Once the 30 minutes were up, the tech came back in and asked me to once again go and empty my bladder. I then came and sat back down where she administered the Lasix into the butterfly port. Also known as furosemide, it acts as a diuretic, therefore increasing urine production, which helps to highlight any blockages or issues within the urinary tract, while also showing how well the kidneys are emptying. I was told that this part of the scan lasts 20 minutes. However, about 10 minutes into it, my bladder started to feel extremely full. She did mention that this can happen while explaining that they would like you to wait until about the 12 to 15 minute mark before allowing you to get up to use the restroom, as by this point there have been enough images created for them to be able to then piece the rest of it together. Doing my best not to think about it, she came back in right about the 13-minute mark, where I then told her I could no longer hold my urine. I appreciated the fact that the restroom was just outside of the room. However, once I got out into the hallway, I noticed that the door was shut and someone else was in there. Feeling as though I was about to pee my pants, thankfully they came out just a couple of seconds later, where I then rushed in and felt relief like I have never felt before. I then went and sat back down, feeling a whole lot better, where the scan continued for about another 7 minutes. Easy peasy, I thought. Once the 7 minutes were up, the tech came back in and shut the machine down before taking the butterfly needle out and sending me on my way. It took about a week for me to get back in to see my urologist to get the results of the scan, and that is when I learned that I do have a small, simple cyst in the renal pelvis of my right kidney, which can mimic hydronephrosis or swelling, make it look like there's a bulge there when actually it's just the cyst. And I also learned that I have a 3-millimeter kidney stone in that area as well. Because I am prone to kidney stones and have actually had an extra renal pelvis due to a kidney stone in the past, the doctor was not concerned and felt that it will pass at some point. And so at that time I was told that I do not need any further testing and that everything looked okay. So if you are someone who was recently ordered to have this type of scan done as well, I can tell you that it's absolutely nothing to be concerned about. You might want to check with your doctor, as I said in the video, to make sure if whether you're supposed to drink this water 1 to 2 hours before the scan, just so that you don't have to wait like I did. And then, like I said, the IV is no big deal. The butterfly needle, it's very small. Technicians are very skilled in what they do, and so you really don't feel it. If you do, it's just a small little pinch and then it's over. Probably the worst part of the scan is having to either sit or lay for that length of time, and the best advice I can give is to make sure and use the restroom whenever they offer you to, just because you're going to want to keep that bladder empty so it doesn't become uncomfortable for you. Other than that, I hope you found the video informative, but if you have any questions or comments, please feel free to leave them. I do respond to every question and comment that I receive, and I just want to say thank you so much for joining me today, and I'll see you again next time.